Welcome to the Cheer Athlete Podcast. Today I have with me Samantha Shutnick, who is in Michigan, and she is a physical therapist and athletic trainer who has worked in all kinds of settings and at college level. And we're going to talk today about EDS. And I want to say this correctly because I taught a course for physical therapists and I got it wrong. Ehlers-Danlos. I always want to say ethos-Danlos. So we're going to talk about Ehlers-Danlos syndrome and get some tips on how we can help make things better. And because it's a pretty common, we'll call it an injury, but it's not an injury process that is common in cheerleading. So welcome to the podcast.
Yes, thank you. Thanks for having me. I really appreciate it.
So give us a little bit of your background and where you're at and who you've worked with and that stuff.
Sure. Who doesn't like to talk about themselves, right?
I know.
So like Laura had said, I am a physical therapist and athletic trainer by trade. I have worked in every collegiate setting known to man. I was a head athletic trainer in a junior college. I ran a physical therapy clinic, which is really where I started to thrive with the Ehlers-Danlos syndrome patients that were coming to see me. And so that's kind of, I can tell that journey in a moment. But so I essentially have worked with cheerleaders like at the young level too, because they were, I used to cover sports while I was in physical therapy school, and there would be like cheerleading camps and cheerleading competitions that I would cover. And the interesting thing that people always ask me about like gymnasts and cheerleaders, right, is like, are they short because like they're good? Are they cheerleaders because they're short and they're good at the sport because of that? Or did like the sport kind of lead to that, right? Like it's always the question of like the chicken or the egg, right? And so like a lot of people that have the ability to move their bodies a little extra than the person next to them tends to go into one of those like acrobatic sports, right? Because they could do splits early. They didn't have to work at it. They had all the opportunities because their body allowed for things that other people's might have not. And so there is, I think, a higher prevalence, like you're saying, of maybe a little bit more of the hypermobility syndromes in some of the acrobatic sports like gymnastics and cheerleading. And so I think this is a perfect fit to come in and chat with your people today.
Yeah. And we're glad to have you. I know that there's a lot of questions like people say, well, can they actually still do things? And is there a higher risk? Did you find that people with the hypermobility syndromes were shying away, like once they were diagnosed, were shying away from cheer or gymnastics? Or
so it's interesting because the young athlete or the young active person might not get diagnosed until a little bit older. And usually they get diagnosed because mom or aunt or sister got diagnosed. And so, and I say that because there seems to be more prevalence towards females, not to say there isn't male individuals that also get diagnosed with hypermobility, but the prevalence seems to be more in the female gender. And it's interesting because it is just a diagnosis. And I say that with the most deep understanding that it does affect you, right? And so you've been dealing with it for a really long time, and now you just have a label on it. And so some people get the label and they go down the hole of like, I'm not doing anything because I'm incapable. Whereas some people get the label, they empower themselves by learning a lot and actually learning more about their body, which then gives them the ability to continue doing whatever it is they love. Because I was always under I'm in more of the school of thought of like, I want you to continue moving regardless of what's happening. And so you have people, and not to go to the far other side, like people that have suffered spinal cord injuries and TBIs and all these things where they actually can't move themselves, they're still figuring out how to move because they don't want to lose out on life, right? And so just because you've been diagnosed with something like a hypermobility syndrome or Ehlers-Danlos syndrome or any of the other things that come along with a connective tissue disorder, doesn't mean you shouldn't be moving. It actually means you should be moving. You just have to learn more about your body than maybe somebody who isn't as bendy, right? And so you have to learn the amount of space that you can move in to keep your body in a safe zone. And so like for me, it was always about, where is that safe zone? How often can you go out of the safe zone for like your sport? And how long does it take you to recover? Because it might take a little bit longer because it's the connective tissue again that's the problem. It's not you, it's just the tissue that's the problem. So it might take a little longer to recover. And you might, like, people talk about a warm up and all that stuff, right? And like a lot of the more bendy bodies don't need as much of a warm up per se because they're already ready to go, right? Their joints are ready to go. Your heart and lungs might not be. But so it's just more about learning yourself and your body. It's kind of like being in school. Like not everybody studies the same. Not every athlete's the same. And so team sports are tough because there's a coach telling you warm up for this amount of time, you stretch for this amount of time, blah, blah, you get the idea. In individual sports, you can kind of have a little bit more of the ability to like make your own. And so that's also the interesting part about gymnastics and cheer, right? Is not everything is done in team, but there is some team aspect. So really empowering yourself and learning more about your body and advocating for yourself to not go like do the party tricks, right? Like just because you can like sublux your shoulder and get it to move away doesn't mean you should. And like same with like if you're standing and your knees kind of go a little extra backwards, like you have to consciously think about not letting your knees go backwards, or when you have some sort of weight on your hand that you're not pushing all the way straight, right? That you're giving a little bit so that you are saving yourself to be able to do your sport for longer.
Those are awesome tips. Let's dive in a little bit to like what is EDS and like what are some common symptoms that people may see, or whether they've been diagnosed or not diagnosed, if they have been diagnosed.
Sure. So EDS is kind of a tricky bug because there's multiple systems that are affected. And so a lot of people notice that they can maybe move their body a little bit differently. They have a little bit different healing time than other people. So like their skin tissue seems to be a little bit different of like a texture. And then if you have some of the other organ systems that are affected, there can be some like GI issues. And so what might mimic like an IBS or something like that. Lots of constipation issues, just digestive issues in general. And so sometimes that's seen as like a intolerance to some type of food. But in reality, it could just be your digestive system isn't moving the food along as quickly as it should be. And so that also gets rated like on lots of different things. And the thing about EDS is usually you need a good quarterback, which if you find a good like physical therapist, let's say, they can't be your quarterback because they can't refer you to like the right GI doctor, the right neurologist, like all those people. So you really need to find a good like internist or a good primary care physician that is well versed in hypermobility and EDS, because some of the types of EDS, we still don't have genetic markers for genetic testing yet, which is really the only way that you can confirm it. And so like the hypermobility type, which is one of the most common and the one that I had treated the most, that is all done clinically. So like you're diagnosed when you meet a certain amount of criteria and you've ruled out other things. So like usually you get like thrown around to different doctors, which takes time. And that's why it's tough, because there's a lot of people that like I said, don't get diagnosed until later because either their family member finally got diagnosed with something, or like something happens where where they need the diagnosis for like a disability purpose or whatever. And so a lot of people get like a hypermobility syndrome diagnosis, which again, it's just a label, right? Like the whole process is you learning about your body. So like extra mobile joints, so meaning like your shoulder can move around a lot, like your kneecap moves around a lot. Sometimes like the flat footed. So if you step down and your arch collapses, a lot of the GI, there tends to be like headache. And there's also the other side of like the mental health side where people don't feel well for so long that there's a lot of depression and anxiety that seems to coincide with it. I don't want to say it's like directly related to EDS itself, but rather something that happens because of all the other symptoms and how long it takes to sometimes find a practitioner that one understands and two can actually help. So there's lots of options that it starts to show its face.
I didn't realize. I've only heard of the hypermobility aspect of it, and I didn't realize all the other, the digestive and wasn't thinking of it as a total body systemic. Yeah.
Well, if you think about it, right, like our whole body is held together by connective tissue and collagen. And so if you have a collagen problem, it's going to affect the whole body system. And people just, especially as like movement professionals, we tend to think about like bones and joints and muscles, but then like your entire organ system is also held together by connective tissue, right? And so you can see how it starts to have this web that it creates.
Yeah. It's amazing. The body is amazing, and how it all fits together and does that. And I know, in our area, there aren't a whole lot of people. I think the closest, so I'm in central Massachusetts. I think the closest specialist, I'm going to say, in EDS is somebody in Rhode Island. So, I mean, it's only an hour away, but it's not in the same state. And, and we have, good children's hospital and all this, so I think, like you said, finding that good quarterback is important, and trying to, and maybe you have to make that trip. Maybe your physical therapist isn't that far away. We were talking before about people used to travel to you. So let's talk a little bit about what you've seen in the clinic and people who are coming to you, and what they were dealing with because they were coming from far away too.
Yeah. So it was interesting. I started seeing, is that blender? Do you hear that blender?
No.
Okay. So I started seeing people with EDS just like out of like just happens chance. I had, I have a residency, I'm a residency trained manual physical therapist. And so, people will like search for that if their doctors are like, oh, make sure you find a specialist or whatever. So I had a woman seek me out. We had done a consult and she talked to me and she's like, okay, here's all the things that happened. She had just had a tethered cord surgery, her second one. And she, had the whole gamut of stuff. So she had upper cervical like cranial instability. So like she got a lot of headaches. And along with EDS, there's changes sometimes with the foramen magnum. So where the brainstem comes out of your skull, there's changes there. And so there's changes in the brainstem, which then affects sleep and appetite and all the other, like the core to living, right? And so there's also that. So she's like, you have to take it slow with me. Like, I know my body, but I can't do like the physical touch stuff that I know you need to do for me. And so I'm like, okay, like, let me learn more about it. And she brought me this, it's probably going to be backwards for you, but it's Living Life to the Fullest with Ehlers-Danlos syndrome. It was written by a PT called Kevin Muldooney. And in here is essentially what my program consisted of that I would have people do like a year or longer of. So this is the book that I would get if you have Ehlers-Danlos syndrome and you want to be physically active again or build strength or whatever. So it walks you through like step by step, like lowest level to highest level in a progressive system going like top to bottom. So like what I would tell people is we would find the area that they were having the most difficulty with. So like let's say it was the low back, then we would go through the low back system. I would let them go home and they would see me about once a week or twice a week to start. But essentially what it was I got them in, I changed their joint position with whatever type of manual I would do, and then they would have to follow up with exercise. So that's where the key is, I think, with physical therapy or OT or whatever type of personal trainer is if you're doing any sort of stretching or mobilization or any sort of touching on the body of someone that has like hypermobility, you have to follow up with a low grade exercise or people will sublux or dislocate. And to me, that was like a big responsibility for me that people were trusting me with their joints that could dislocate at any time. And so you really had to, for any professionals that are listening to this, you really have to stay in your low grades, like your grade 1, like you're never going to end range because their end range is out of the joint. And so you have to stay in that. And so part of your job is teaching the patient to stay in that range as well. You stay in that range and then follow up with low grade exercise. And a lot of the time, the stability muscles are the ones that they've been pooped out and the prime movers. So the big muscles are the ones that are doing the job and they just can't do it. Like they're not made for that. And so this book does a really good job of really setting the foundation. And then you go like body part by body part. And so I would see them for a little bit. We would teach them that stuff. I would give them the homework. And then you have to be able to do these things. I believe it's for 2 minutes. Doesn't matter how many sets or reps you get in that 2 minutes, but you have to be able to do it for 2 minutes straight before you can move to the next one. And so sometimes I would take people weeks to get through a exercise before they could progress, which they don't need me for. They just need the time and they need the guidance. And so the book is really helpful. But then what I found is people are people and they don't do it unless they have accountability, right? Which is where this like jointly aligned physio and some of the offerings that I have came about is this book is gold, but you also need somebody kind of there to answer your questions and to make sure you're doing it and to keep you accountable is essentially what it is. But an insurance company won't allow for that. So like, that's where I would come into a problem is these people would drive for 1-2 hours to come see me. They either would be so flared up by the time they got to see me that we couldn't do anything. And so it was a waste of their time, or they had to cancel all the time because as we know, EDS goes like this, right? You'll have a really good day, really bad day, and it could be like in the matter of an hour. And so I wanted people to have something that they could plug into on their bad days that they could go in and also on their good days, right? And do I think it's a substitute for actual manual care and having eyeballs on you? No, but I think it's a good place to start. And so the thing in the clinic is it just takes a lot of time and the clinic isn't set up to take a lot of time, like either in a setting or for like long-term in terms of weeks and months and years, right? Which is the type of relationship that I would build with people. And so we had to play the insurance game, which is fine. I was willing to do that, but it didn't seem to do justice to people. So that's kind of, I would see just the need for some sort of change in their joint or their soft tissues, and then a follow-up with exercise was almost across the board, everybody that I saw that had Ehlers-Danlos syndrome or a hypermobility syndrome.
That resource is awesome. I'm going to check that out.
Yeah.
It's so I've worked, I think I only have seen one person that was actually diagnosed. I think there's a lot of people that I know there's a lot of people that I've actually referred out with a question of it. but this was in a personal training setting, and we did a lot of stability work, and still taking through range of motion, but doing more graded exercise, and she did have some up and down days too, but I think on a whole, like, she was feeling stronger, went out, and I ended up just giving her a program and going from there.
Mm-hmm.
Do you find that people can, like, once they're into, so you work with them for the year, they build the 2 minute of the exercise up,
Mm-hmm.
and build on that, like, do you find that they're seeing lasting changes? Like, is this something that I would expect they would have to keep this going long
Correct.
term? Yeah.
Yeah.
And that, so go ahead.
So I think that it's all a foundation, and if your disease process is going to go towards you getting less and less mobile and less active, the more mobile you can be on your good days, the better you're going to be on your bad days. And you're still, like, every day is going to be different. And that's kind of the tough thing with this process and this syndrome, is it very much is a syndrome, right? Like, so it's all encompassing, and it might be a migraine one day, and it might be like such bad bloating and constipation that you can't move. Like, I've seen it both, right? But the nice thing we know about exercise is, regardless of disease process or not, exercise helps all of those things, right? And so we know that it helps with mobility and digestion, right? And so if you know that you have one of the symptoms that includes the GI, a low load exercise is going to long-term help, right? And so I think that looking at this, as much as you would take like a prescription drug, you have to use this as like a prescription exercise. Like, it's no longer exercise to feel good, to look good. Like, right. It's no longer about vanity exercise. It is now about your ability to move the way you want to move for the long term. So, like, as an athlete, yes. As a college student, yes. As a young mother, as somebody in their 40s, as a grandmother, like, I've seen the whole gamut of people with EDS, and the sooner you start a prescription exercise, the sooner you can, like, do the things that you want to do, with the expectation that there's going to be some days that you can't, and that's 100% okay. And I think that that's where the disconnect happens with athletes, is it's like, well, I'm injured. It takes this long to get back from injury. But when you have a syndrome, it's not an injury, right? It's just the way that the tissue is, it isn't meant for athletics. And so you have to be very aware of your body, is essentially what it is. You can still do athletics. I've seen very successful athletes that have EDS and hypermobility syndrome, but they also chose to learn about their body and to really look at exercise outside of their sport as a prescription, if that makes sense.
Yeah. But making it part of your lifestyle. One thing I teach a lot is I'm going to call it body awareness, but kind of more being like in tune to where your body is in space, where, joint positions are, just starting to kind of listen to what your body needs in that moment. And I think that's a key piece that, that you said you're teaching is, body awareness. Like, what can my body do today? What do you find that it's hard because of the hypermobility, that they like have a hard time with proprioception or kinesthetic awareness, knowing where their body is in space? Or do they even recognize that they're hyperextending something?
So it's interesting, because I think, so here's my theory on it, and this is how I explain it to people, and usually it clicks. So hopefully it'll click for your people. Is whenever I had a young woman come in for, like, to talk about EDS or hypermobility, they almost always sat with their legs crossed and their ankles crossed. So they crossed 2 times. And I always attributed it to, they want as much feedback into their body as possible. And I say that because if you have a joint like this, right, So somebody who has a stable joint, it stays like within this range, right? So they only get that little bit of feedback that goes to the brain. The brain says, okay, you're here. You don't actually think about this because it's just something that's subconsciously happening over time. But if you're listening to this in the car, or if you're listening to this on a chair, you forgot that you were sitting, right? Like, and now that I bring it up, you're like, oh yeah, my butt is on the on whatever surface it is, right? Like our brain is smart enough to shut off that stuff. So you're not always thinking about this joint moving. But somebody who has EDS or hypermobility, they go a lot farther. So they get a lot more input into the brain. But I think it also has this like almost like protective mechanism where it's like too much, too much, too much. But that's the only feedback they actually get, because all the other feedback is getting like is just being integrated and isn't being made aware of. And so they tend to spend time at the very end range or cracking all the time. There's always the cracking, like cracking of the back, cracking of the neck, cracking of the elbows, of the knees, of the hands, of the everything. And in theory, I think it's because they're just trying to get more feedback into their joint of like where they are in space, which makes sense, right? Like if you're constantly getting this like scary signal, right? Like this protective signal, you're going to try and find where you are in space more often so that you don't get that. The tricky thing is actually bringing it to your conscious like area of your brain and being like, okay, I'm standing and where are my knees? Are they like all the way kicked back, or do I need to make them soft? Right? Like they talk about like locking knees. People that have hypermobility tend to lock their knees every time because it's easy, one, and it's safe for them, right? And so, and their muscles are tired a lot of the time. So the muscles that would keep you in that stable, safe position, like aren't going to fire as well because they're exhausted. So you see how, again, building that foundation would be helpful to even just stay in the range of like safe spots for your joints. And so that was, like I had said, a lot of what I did. And Laura, what you had talked about, like finding where your body is in space and keeping it where it should be.
That's, I would think, in a cheer world specifically, because we talk about locking out all the time. You know, a flyer needs to lock out, lock your knees, and it's not necessarily the best position for your body in general, but if that's a safe spot for you, again, so strengthening can help, and getting that more centered position. But that's
well, and like you're saying, so if you're an athlete and you have to lock out because you're a flyer, then you need to not lock out any other time.
Yeah.
Right? So it's like if you're not supposed to lock out, I have to lock out at this point in time, at this point in time, and at this point in time for my sport. So then when I'm just standing around at school, I need to not be locking out. When I'm standing around like waiting in line to go into the movies, I need to, so it's all the other parts of life that you have to be aware of, not necessarily just in sport. And eventually it'll tie over into it, right? Like where you're just waiting around.
Right.
Don't lock out, right? Like if that's not where you should be. And so that at the very beginning, I think it said something along the lines of like, if your sport needs you to be in a position that you're not supposed to be in for a long time, then you don't get to be in that position all day long, right? And so it's like you have to prioritize when you're going to put the extra stress on your body, and also understand like I'm making this decision to put this extra stress on my body because I love this sport so much. And I understand I'm going to have to take a little more rest. And I'm going to have to pay attention outside of my sport in order to be a good flyer, to be able to lock out, to do those things, right? So it's like, it's not so much like you can't lock out. It's you need to be specific in choosing when you are, if that makes sense.
Yeah, I think that's a great tip. Great advice. One last question on this end. We talked a little bit about, or you talked about low load exercises. For those who don't do exercise prescription, what are some examples of low load exercises?
Yeah, so it depends on like what body part you're looking for, but so like anybody that's an athlete, it's gonna feel like the most boring exercise in the world to you. So it's gonna be the stuff like on the floor and or on a mat or on a table where you're more focusing on like breathing and where you are in space. And for people that maybe don't move as much as like a cheer athlete, it's good. It can feel really hard, right? And it's interesting because some of the really good athletes that I've had that excelled at their sport, I would get them on a mat to do something as simple as like learning how to breathe. And it was so frustrating because it didn't just click, right? And so it might be hard here, but not so much in the activity. So that I think that the low load stuff I'm talking about is more the stabilization exercises and the boring per se that a cheerleader is going to think, right? So it's the deep core work. It's going to be the stabilization of the neck, of the shoulders, of the abdomen and glutes and all the boring stuff. It's not going to be the big like Olympic lifting and the fun stuff people like to do.
Plyometrics and yeah. Thank you. That was an excellent explanation. And as I'm talking about this, I'm thinking about a client that I'm currently working with who had a hip injury and surgery, but every moment she wants to click everything, crack everything, and she definitely has some hypermobility symptoms. And she gets very frustrated because I'm like, let's get back with your breathing stuff, we don't need but I think that's a key takeaway right there. So what have you got going on? And you mentioned the program that you talked about a little bit, but tell me more about that.
So like I had said with the book, I'll show it one more time. So essentially the program I'll say it, I'll build it out in 2024 and they'll go live in 2024, is essentially a community of people with either hypermobility or Ehlers-Danlos syndrome that can plug into that book with me coaching through it in a space that is available to them 24/7. So there'll be multiple options of like how much access you can have to me, but essentially it's making sure you get in and you exercise however many days a week you decide, right? So get yourself on a program that's designed for you. And then it'll go through the book. So if we'll prioritize what's the thing that's bothering you the most. Is it the neck? Is it the shoulders? Is it the elbow, right? Like we'll make a checklist and then we'll go to that page. Here's the exercises you start with, and it'll progress you through that at your own pace without worrying about your insurance, still getting taught by a PT that's, treated hundreds of people with hypermobility syndromes, and then be able to plug in for like, I haven't quite decided yet. So it's going to be some sort of like live training, some sort of accountability groups, all of those things. So you'll be able to plug into people that are kind of living a similar journey or at least on a similar path. And my goal of it is really making it an empowering space, because a lot of the like Facebook groups and things like that, they can tend to be very negative, and instead of really building people up, and there are some really good ones, don't get me wrong, but a lot of them are very much about like complaining and letting this dictate your life versus you taking control of what you can control. And I think that you can control your movement. So yeah, that'll be live in 2024. I do have an Instagram and a Facebook that I can that we can link out that you can connect on. And that way when it goes live, you can have first access to it. So
awesome.
Yeah.
I think this is going to be incredible for people, because I definitely think there's a need. I'm going to say globally, but I know in my area,
yeah, I think it's global. So
and for people to have the resources and someone to talk to and have a positive space, that this is a a disease process, a syndrome, but it's not a life sentence. I mean, it's a life sentence, but it's not it's not, there are things you can do to live your life and to still be active, still
Correct.
cheer and still do things. You
Yep.
just got to put the work in, like with anything.
Exactly. Right. Exactly.
Where can people reach you?
So I'll drop in my Instagram, I believe, is the Jointly Aligned Physio, and I believe the same thing on Facebook. So I'll make sure we get a link out to those. But both of those they're not super active, but they're there. So you can follow there, and as soon as they get active, everybody can jump on board.
Perfect. I'll make sure those are in the show notes.
Awesome.
Thank you very much for being here with us, Samantha. I think this was really great information, and I think a lot. I think there's a starting trend for people being diagnosed, which is a good and a bad thing, but because more awareness brings more positive changes. So, and I think this is going to be very valuable for people. So, thank you so much for being here today.
Yeah, thank you, and I hope everybody at least learned something. And what is it? Get back out on the mat? I don't know.
Yeah. Stay on. Yep. Hit 0. Be on the mat. Yep. All right. Thanks everybody for joining us today on the Cheer Athlete. Don't forget, when in doubt, breathe it out and take life one step at a time. And as my friend Drew Kelleher said, you are responsible for your own vibes. So go make it a great day.